Today we're going to be talking about health-related behaviour change, and specifically in response to perhaps a loved one who may be hesitant about taking a vaccine. So we're going to look at some ways that we can approach that, because it can be a difficult situation and cause a lot of worry and distress to ourselves. Obviously, we might have concerns for our loved one. But it seems that the more we try and talk to them and encourage them to be vaccinated or grab that booster, that the more that they are hesitant to take that route. So we're going to take a look at that now. Let's get going with it. So the first thing, the number one thing that we want to do before we begin talking to our loved one about their behaviour change is to look in ourselves and say to ourselves, are you using the right approach? Do you have the right attitude and the right approach here? So in health psychology, we know that behaviour change isn't easy. If it was easy, then health psychologists like me probably wouldn't need to exist. But we do know that there are things that we can do that are more effective than other things we can do to help that behaviour change along the way. And part of this is an attitude of acceptance and compassion. So the first thing you really want to ask yourself is, am I nagging here? Am I the broken record? Or even worse, am I using shame, either consciously or unconsciously? Am I using shame to try and shame this person into doing what I want them to do? So, as health psychologists in health-related behaviour change, we know from many years of research that shame is a poor tool. It is an ineffective tool for bringing about behaviour change. And how do we know this? Well, let's just take our lay knowledge for a minute, our common sense. When we look around us, for example, in the case of obesity-related behaviours, things like healthy eating, exercise, things like that. If shame was an effective tool, then nobody would ever be obese, would they? Because there's certainly lots of shame to go around, or traditionally has been lots of shame to go around that idea of obesity. So, studies of the effects of shame and behaviour change have been conducted as examples around things like smoking and lung cancer and weight loss and diabetes. So those conditions that are related to certain types of behaviours. So from studies like these, we can also see that in addition to not being very effective as a behaviour change tool, that shame also has this really kind of unpleasant side effect of creating stigma. And that stigma is a huge problem. Why though? Why is the stigma a problem? Well, it contributes significantly to health inequality. So the implications of using shame and relying on shame as this kind of implement, this kind of punishing implement to get people to change their behaviour, the implications of using that can be very widespread and quite deep and problematic. So we don't want to be taking that attitude when we're approaching somebody, especially somebody we care about, when we're thinking about changing behaviours. So the next thing that you want to do is look at whether you are using fear. Are you using fear as a motivator when you're talking to this person about their behaviour change? Because not only will this make the behaviour change less likely to happen, but using that fear, using that bit of menace, the doom and the gloom, that could also affect your relationship negatively there, and affect that person's trust in you, which is not something you want. We're going to look at that a little bit more as we go along. So if this is something that you find yourself doing, you're kind of doomsaying and using fear to try and bring about that behaviour change, then stop yourself and ask yourself, what is going on? Why am I doing this? And explore that in yourself a little bit. So how can we approach things better here? What can we do that is better than those two things, the shame and the fear? Well, firstly, and hugely importantly, we need to listen and listen and listen some more. And try, when we're listening to our loved one, talk about what is going on for them in respect to this. The example we're using is the vaccine hesitancy. Is listen to what they are saying. But when you're listening to what they're saying, try and hear the feelings behind that rather than the content of what is coming out. And very often, you will find the emotions that are driving that behaviour if you do that, and the obstacles that are there for that person. And very often, for people around health-related things, this can be about fear. It's a really common and difficult emotion. And that avoidance that people can have around things like vaccination and that aversion that they've got to these sort of interventions. And kind of natural. They're in response, they're all around our threat response that we've got. So it is kind of natural for people to want to avoid this stuff and distance themselves from this stuff. So that fear-driven approach that we were talking about earlier to the behaviour change, if you use that when this person is already experiencing fear, then what you're doing is you're tapping into an already activated threat response. So you're kind of potentially throwing fuel on that fire and amplifying that fear for that person. They've already got their fight or flight system all activated around this subject. So if you're piling more fear on top of that, then that is kind of exacerbating things there. So that's something that you need to consider and have a think about that. And just try and stay away from that fear-related stuff. So you've done your bit of listening. You've heard what your loved one has to say. And you've listened. And you kind of just sat back and accepted all that and listened to the emotions behind what they're saying and things like that. So before you start talking, before you start speaking to this person, a really great thing that you could do is remind them that you care. And this conversation that you're having is based around your concern for their well-being. And to do that with warmth and empathy and respect and honesty. So to do all of those things is really going to help your communication in this difficult conversation that you're having around the hesitancy of the vaccine. So, beginning your conversation with that expression of affection, you're going to be using your warmth to engage that person and keep them engaged and invested in the conversation that you're having. And I know that this is something a lot of you will be saying is common sense. But the thing is, when our emotions are aroused, when they're triggered, when they're activated around an emotive subject, when we're worried for someone else quite often, then our own emotions can come out in some very strange or unexpected ways, and they can come out in ways that we don't necessarily want them to come out in. So just reminding ourselves to come at this with warmth, with affection, and with honesty is a good place to start before we begin even speaking. So what else can we do once we've begun this conversation? Well, something that we can do, of course, is inform. We can do that. And informing your loved one is a really great idea, but what you don't want to be doing is bombarding them persistently, kind of swamping them day and night with vast amounts of stuff about vaccines, about the benefits of them, all this stuff. You don't want to be doing that day and night. You don't want to be completely overwhelming this person. And you're very concerned and very scared for this person and their well-being, and it can be hard to hold yourself back in that case. But our main priority here with this conversation is to not alienate this person, to keep them engaged in a dialogue with us, to keep them at the table. And to do that, we have to make talking about all aspects of this okay. We have to keep doing that. So we don't want to be completely just, overwhelming them with all of the stuff that is out there that we want to tell them. So keeping someone engaged might be even more important if they're spending a lot of time on one side of this particular debate, if they've gone down the rabbit hole a little bit and they're busy absorbing all kinds of information from all kinds of sources, all kinds of maybe even questionable sources. So what we're doing here is trying to keep them engaged with us so we can offer them a more balanced view. So if that person cuts us off, of course, if we kind of alienate them by overdoing it, then of course they become a little bit more isolated from that balance view, from those other voices around this debate around vaccines. So whatever their views are, whatever their views may be, hear them and listen to them and kind of validate that and say, yeah, I'm hearing you. Rather than getting into this tug of war, this war of attrition. So you hear their point of view and you listen to that and you keep them engaged with you. So after that, what can we do? How can we give them the information that we want them to see? How can we give them that more balanced view of the big picture around this idea of vaccination? Well, we try to keep any information bite-sized and easy to digest in small chunks. You want to keep it accurate, truthful, and up to date as well from a reliable source. So that is a scientifically informed source, ideally, with good evidence. So one great way to approach how you offer this information is to frame it as an alternative choice or as additional information for this person to take away and examine and look at themselves critically, in addition to any information that they've already gathered themselves. So it's like a bit of extra information that they've got, rather than dismissing off the cuff their views as is unpalatable or unacceptable. We're not judging. We're not calling their ideas rubbish. We're not being pejorative or negative. We're not doing that. But what we are saying is that here are some alternative views for you to think about, to consider, and at least look at before you dismiss them. Yeah, because of course by this time you've sat and you've listened to their views and you've kind of validated that and listened. So you can kind of frame this as part of a discussion. I'd encourage you to do so. So also different people also absorb information in different ways at a different speed. So some people prefer it written down, other people like to watch a video like this one, and some people prefer to do it in person. Some people prefer to have a chat face to face with someone. So consider your loved one's preferences and try to offer them this information in a way that suits them, a way that makes it more likely that they will engage with it. So maybe even after all of your efforts, all of your patience and your listening and your time, it could be that your loved one is still absolutely adamant that they won't go for vaccination. For example. So a good way, how do we respond to that? What's a good way to respond to that? Well, a good thing you can do, remember we're trying to keep this person engaged, is to say, well, okay, vaccination's off the table. And ask them this question. Use a nice open question like, okay, that we're not going to do that. That's your decision. But what other things could we do to reduce the risk to you then? What are your ideas? Let's talk about them. What are the things that you would be willing to consider to reduce the risk of infection to yourself? And let them come up with those things that they are willing to consider doing or thinking about or exploring. So if they do this, if you kind of encouraging and eliciting that, if you're trying to get them to come up with those ideas themselves, then they, of course, are much more likely to follow their own plan and follow the beat of their own drum, aren't they? And as well, they're much less likely to become defensive or angry or withdrawn and kind of take their ball and go home and not talk about this anymore, which of course you do not want. So people tend not to like advice that they haven't asked for or that they don't want. And a lot of people don't like being told what they should and shouldn't be doing either. Now, as a health psychologist, very often we know that people who are engaging in behaviours that aren't so healthy, very often they know only too well that those behaviours are not particularly healthy. They know a bit about the risks. And to just keep going over and over it like a broken record at them, we're not really telling them anything about risk that they don't already know quite often. And all we are doing quite often is adding irritation and defensiveness to that situation. So we're actually inserting a barrier that wasn't there before. So to kind of keep the flow of things going, that's a great thing to do, to offer those choices, keep your questions open and keep that discussion going and see whether they can think of things that they may be willing to do to reduce the risk to themselves and their health. Now, lastly, I want to finish up this video, and I hope it's been helpful to you, but I do not want to finish without pointing out this last one thing that is so important, so unbelievably important when it comes to this topic that we're talking about. And that is that, remember, you can only do so much here. We aren't put here on this earth to make other adult people's choices for them, to save them, to rescue them, to control them in those kinds of ways. That's not why we're here. And ultimately, the choice of your loved one is their choice. And so that even though you might love them and you might be so concerned for their well-being, there is a point that you must respect their choices and their boundaries here. And there comes a time when we do have to step back and we have to recognise that there is no more that we can do. And this person that we dearly care for is in possession of their own mind as a sovereign human being and as an adult. And they're doing what they believe is the best thing for them. So we can get into a tendency, we can get into frustration, we can get into beating ourselves up and consuming ourselves with worry. So do not be harsh with yourself if all of your efforts don't go anywhere here. If this happens, then acknowledge that difficulty, acknowledge the hurt and the frustration that you're feeling in that moment, and be kind to you, be kind to yourself in that moment. It is a painful feeling to think that your loved one may be at increased risk of a dangerous disease or putting themselves at risk in any way with their health. So take a second to recognise your own worry, your own suffering, and soothe and care for yourself. Nourish yourself through it, because you are important too. You are important in this. So do that. Make sure that you take time for you. So I hope that this video has been helpful for you. If you enjoyed it, don't forget to like, share, subscribe. If you have any comments about your experiences of being in this situation, talking to a loved one about the idea of vaccination or any other health related behaviour that you're trying to encourage in someone else, just put that in the comment section. Let's discuss it. And if there is anything that you'd like me to cover in the channel, of course, just let me know. Stick that in the comments too. It's always a pleasure to be here and to talk to you all about health psychology and health related behaviour change. So, yeah, I'll see you next time. Thank you for joining me.